screening. I will say it can be cough over a few days, just to be sure, get some attention.
So that should be standard procedure now?
Yes.
Okay.
Just get health attention, be seen by the health workers so that we find out exactly what it is. But if the cough persists and it goes on for more than 2 weeks, we then consider it may be TB. And we usually have to screen you for TB. As my colleague has said, we have the diagnostic centers, wherever public health facilities, where you'll be asked to give us your sputum, and we look at it in the lab. And if it's diagnosed from that first point of investigation, then we just put you on treatment. If we still suspect you have TB, then we may ask you for an X-ray, chest X-ray, to just find out exactly what is happening in the lungs. And if so, and in addition to the clinical symptoms, which Joel has mentioned, mainly cough, fever, weight loss, night sweats. But the cardinal sign, cough is the first thing. But you may have cough and the additionals that I've said, the 4. So we examine you all round, we take history all round, and we screen you, and we try and confirm the diagnosis. As my colleague has said, we have now better and faster and more accurate diagnostics that have come in, the Gene Expert, which helps us to diagnose faster. So for us, we say anybody who is coughing, get screened so that we rule out whether it's TB. And if we find that it's TB, treatment is available, and TB is curable. Okay.
Dr. Mungai, you've mentioned that it's a bacteria that sort of grows or generates, I don't know what the medical term is, but my understanding is that it metamorphosizes over time to now manifest as TB. What's the period that one should give themselves? Because coughs are very common. It's a common thing, and you could just be coughing out of an allergy. You could be coughing because maybe there's an irritation of some kind. But at what point do you now decide as an individual this needs medical attention?
Okay, so any cough needs medical attention. But really the reason they give as 2 weeks of cough is because you know, maybe if it's a cold, or you know what you would like to say normal cough, although they might not be anything like normal cough. Anything that is causing you to cough means there's an irritation of some airway. So but 2 weeks, if you have these symptoms for 2 weeks, for sure, if you go to a facility, if the medical practitioner does not tell you about TB, you probably should ask them, do you think I should have a TB test? Because I think if we create more awareness among, you know, even the patients, among the general public, then we'll also demand for more of these tests to be done. Yes, so currently there's a thought of 2 weeks, but as I said, WHO actually says any cough, especially because Kenya is a high burden country in terms of TB. We actually ranked about the 15th among the 22 high burden countries in the world. 15th, yes.
Okay. That's fairly high.
Yes, it is.
Okay, Joel, coming back to you, what is it that you wish you knew now, or rather, if now that you went through it and you survived, what advice would you have to anybody who has that cough? What is it that you learned later that you wish you knew then?
Okay. One, it basically has to do with awareness. As a journalist, I will be more concerned with do people have information of how TB, as both the daktari are saying, how do you, if at all you have an explained cough lasting more than 2 weeks, or maybe chest pain. Daktari here talked about other factors like sweating at night and all that. Do people have that information? Myself, I was privileged now because I'm a journalist. I can interrogate, I can interview daktari, and I can get some facts and all that. But there are some people out there who actually by there do not know the causes actually by there, like for example the causes of TB. And TB is spread through airborne, that we are supposed to, if at all you are in a place whereby is vulnerable to get TB, like for example slum areas and all that, you are supposed to actually by the like coughing, if at all you have TB, to actually by the cover your mouth with handkerchief so that you don't infect other people. So those factors, and then again another factor like for example, well ventilated, is the place that you are, is it, do we have air circulation coming in, because that's also another contributing factor. And then again, maybe a pointer like a journalist, I would say a program like this actually by the is good because it's empowering people actually by the to know what the people are supposed to know about the TB. And I would actually by the urge our media houses and to actually by the create more platform whereby they are giving journalists more space and more airtime so that they can do a well-researched stories and they can give people that information.
Okay. And in case you're watching us at home, we'll now open up the phone lines in case you have any questions. Maybe you have concerns. Maybe you have a cough that has been persistent and you'd like to get the doctor's word on what needs to be done further. We'll open up the phone line, so feel free to call. You can also communicate via Twitter. Let me come to you, Dr. Ongango, and just some of the causes that he has mentioned. One, to validate that that is correct, and secondly, what other causes that might be there?
Okay. The cause of TB is by a bacteria or a germ. I would call it a germ in simple terms. And how someone acquires TB is by inhaling the germ, which could be in the air. Someone who is infected with the germ coughs it out and it goes into the air, and anybody can inhale it. So what that means, anybody can get TB because we all breathe air. So linked to that, there are risk factors associated with that. If you are in an overcrowded place where windows are not open, the ventilation is poor, you are at more risk to get tuberculosis. If your immune system is low, for example, in diseases like diabetes, where your immunity system may be low, and also like in HIV infection, if you have it, you also are at a higher risk of getting tuberculosis. Also, if you are malnourished, you also it leads to low immunity, and it could lead to someone getting tuberculosis. And also related to ventilation, housing. Housing where there are no windows to allow air in, and also where poor lighting is. The germ thrives very well in situations of darkness. So there are these predisposing factors that individuals have. Then of course, still linked also to immunity, you find the younger children, the babies less than 5 years, are more likely to get TB because their immunity has not yet developed well. And then also the older generation, also the immunity has not developed well. As you know, TB is an infectious disease. So actually we used to call it, it's a communicable disease. It's a disease that is in the community. And some of these factors I have mentioned are related to the socioeconomic status of somebody. So this leads to what I would call, what I can call poverty. You'll find people who are of low income, you'll find maybe they are getting more of the TB. But it's because of these other risk factors that they are more likely to have. Someone staying in the slum is more likely because of the condition of housing. They are more vulnerable. Okay, and also in situations like in institutions like prisons, you would most likely expect TB to be more prevalent in such situations. And also we do have cultural beliefs which may lead to people getting TB, whereby it's sort of myths, I would say, whereby people think that TB is caused by a curse, and this is wrong. And when someone now has TB, because once you have TB, you can actually spread it to somebody else. So instead of seeking for health care, someone delays out there with the disease and continues to transmit it to the others who are around them. So some of our cultural beliefs may also lead to that, and that's because of this misinformation of the causes of TB. And this actually also leads to some kind of delay of seeking health care. If somebody thinks otherwise, that it's not curable, and also there's no need of seeking health care, they can do anything other than getting that health care. Maybe they will just go to a traditional healer who does not know how to treat TB the conventional way. And so you are delaying it, you are transmitting it to other people.
Okay.
So,
Dr. Mungai, you've talked about some of the gains we've made, especially from the time Joel contracted TB to where we are now. But would you consider TB a problem in the country currently?
Yes, TB is still a problem in the country, and really, you know, as we've all said, the awareness is very important, because, you know, even the people at risk don't quite know they're at risk. Dr. Jane has already said some. I would like to add diabetes. When you have diabetes, you're immunosuppressed, and hence you can get TB easily. We have a lot of cancer cases now. One of the things that, you know, as they are being treated, is the chemotherapies or radiotherapy actually reduce your immunity further. So what happens? Because we all are exposed to TB, we've all, you know, inhaled the bacteria. Most likely, if we check all of us right now, we all inhale the bacteria at some point in our life, because, you know, in Kenya there's still a lot of TB. But what happens is that you don't get sick immediately. In fact, you can live your rest of your life without having the actual disease, but you have the infection. You've inhaled the bacteria and it has lodged somewhere in your body. Your body is able to control it. But now, if you get something that brings your immunity down, you know, you're alcoholic, you're not taking food very well, you get malnourished, or those other things that we've alluded to, then you're at a higher risk of now the bacteria now exploding further. So you actually start getting the symptoms. So yes, so TB is a problem, because we have a lot of latent, we call them latent infections, infections that are not showing. But if you get to a situation where for some reason your immunity reduces a little, I mean, we are all stressed all the time.
At one time or the other.
At one time or the other.
Yeah.
So yes, so it still is a problem. Even with the gains we've made, we think we are still missing. In 2014, we treated about 90,000 patients. Yes, those are the ones that actually accessed a facility and were, you know, registered in a facility. But we still think we are missing about 20,000 more.
Okay.
You know, yeah.
Dr. Ngango, how available is the medication, especially when it comes to the rural area? The urban areas, we may have access to clinics and hospitals, but when you go to Mashinani, how available is the medication?
actually, the medication is so available. We have about 3,000 treatment sites. These are public health facilities. This may be the county hospitals or the sub-county hospitals or the health centers or the dispensaries spread out all over the country. We have about 3,000 treatment sites. So access to treatment is in those health facilities, and in addition, this is treatment that is provided by the government free of charge, and we do provide the treatment for 6 months. We give the medication is taken on a daily basis, and we ensure that the patients come for their follow-ups. So we, apart from just providing it with the government commitment to provide it free of charge, as health workers, we also emphasize adherence, because 6 months is a long time, and also taking tablets every day is a big burden to the TB patients. So we encourage adherence, meaning that you come and get to your follow-ups. In the first 2 months, we encourage them to come to us every week to get their medication, and in the next 4 months, they come to us every 2 weeks to get their medication. And all through, we follow up to make sure they are cured. So we provide also the services for checking that they are cured through our laboratories. As much as we screened you at the beginning, during the treatment, we again screen you to make sure the bacteria is not there, so that at the end of the 6 months, we can declare that you are cured or you completed the treatment. So what I would say, access to treatment is there. It is spread out in the country, and even access to diagnosis, I would also say, is spread out. We have about 2,000 treatment sites all over the country. These are, when I say diagnostic sites, when I say diagnostic sites, I mean a laboratory which is available where you can go, produce your sputum, and we look at it under the microscope, or possibly do the gene expert. Yeah.
Okay. Joel, how long did you take to take your medication and now be given a clean bill of health?
Thank you for the question, Michael. For myself, as Dr. has said, because TB is treated between 6 to 9 months, however much we have, you talk about the gene expert. No, that was for diagnosis. I was supposed to take 4 tablets in the morning and 4 tablets in the evening. Let me start by that. Every day for the next consecutive, they were calling it intensive phase, and then again I continued with the continuous phase. So I took my medication to, by the way, I should have pointed out this. I was put on there were this medication that were on trial by then in the 2005. And I was told the reason being they wanted to reduce instead of you taking the medication for 9 months as it's supposed to be, there was this medication that this medicine, new tablet that came in the country by then that I was supposed to take by 4 months. So I took myself, answering your question, in the next 4 months. But by the time the 4 months were over, I went to be, as Dr. has said, the checkup, the follow-up, whether the bacteria is still there, is it alive? And then again I was told the bacteria is still there. They checked. And I was told now I have to continue with another 4 months. So initially I was supposed to take in the 4 to 6 months, but then again I ended up taking the medication in the next 9 months.
Okay, 9 months. Dr. Mungai, the other point of concern for many, of course, would be cost. Is it affordable? Is the government possibly subsidizing? What's the cost implication?
So actually, as it was said, the treatment itself is free. The diagnosis is free. So therefore, the government of Kenya and also other donor agencies have made sure that, TB treatment is free for the person who is taking it. That means they bear the cost, yeah? So when you go, there's no, you're not charged,
cost.
no cost. So even as you take the 6 months of treatment, it's at a free cost. The concern, of course, is that the patient has to come daily, yeah, and those are the areas that we need to look at, especially now that you have also county governments on board, because access is not just at the facility. At the facility you get the medication and it's free, but maybe now getting there. But really, because that medication, a dose of it would be very expensive to the patient if that was to be charged. Actually, at some private facilities do charge, but we are in partnership with private facilities to ensure that actually medication can be gotten free of charge.
Okay.
Yeah, for the ones
Dr.
that
Ongango, they say information is power. Is anything being done to ensure that this information reaches the villages?
Yes. The way in the Ministry of Health, we do have a department called the TB Control Program. And this program is found right down to the county level, up to the sub-county level. And down there, we have managed to coordinate activities related to controlling TB. And one of the activities is passing the messages to the people. And this could be in different channels, depending on the community dynamics. Down at that level, we disseminate a lot of information on the basics of TB, and to make a summary of it is we pass out the message that TB presents with cough, the 4 cardinal signs: cough, fever, night sweats on and off, yeah, and weight loss. Any of those you could have. Come for screening to the nearest facility. That is the main message. And coming there, we ask you to give us your sputum for screening. And then we also emphasize that it is curable and it is preventable. How is it preventable? It is preventable by, first of all, coming, if you're sick, come for early screening. 2, make sure your environment is not leading to overcrowding, and your house is well ventilated, well lit. And if you get anybody who is coughing, you also advise them to come for screening. So messaging of of what TB is and what can be done goes on right down to the lowest level in our country. So I would say yes, these messages are going on, and as World TB is coming, we even make it more of a climax to bring out this message, because the purpose of World TB is on a yearly basis is to actually think, what are we doing to control TB? Because we want to actually finally eliminate it.
Okay.
We don't want to have TB again.
Right.
We want zero TB.
Okay.
Yeah. So the purpose of it is to bring stakeholders together, be health stakeholders, be non-health stakeholders, to come together, and we focus on ways of how to reduce the TB.
Okay, and hopefully finally eliminate it.
Yes.
As we close, Dr. Mungai, what's the one thing that you'd want everybody to know in regards to TB? What's the one message you'd like to get across?
Okay, so I would like to say that you had this, TB is preventable, it's also curable. So if you have symptoms that you think need to be checked for TB, we need to do that. But in addition, Ministry of Health cannot fight TB alone. As you've heard, it's a social disease also. In the European countries, there was a lot of deaths in TB before, but as the economy improved, then those deaths due to TB reduced. So it's a social TB.
All right, thank you very much. We'll have to wind it up right there because of time. Dr. Brenda Mungai, Chief Party Center of Health Solutions with TB ARC. We also have Dr. Jane Ongango, who is from KEMRI. Thank you for joining us. Last but not least, Joel Magu, who is a TB survivor. Well, World TB Day is going to be on the 24th of March, and just like Dr. Mungai has well put it, that it is something that you also need to participate in. That's why we're going to wind up Morning Express this morning. Thank you for joining us, but do stay with us. We've got News Track coming up at exactly 9 o'clock.